You're live.
Thank you. Good morning and welcome to the board and online viewers to the December 3rd, 2025 Board of Health meeting. The board meeting is officially called to order at 8:02. This virtual meeting is being streamed via YouTube and it will be rebroadcasted later on Facebook. The November minutes were distributed to the board for the review prior to the meeting. And please remember that in compliance with the Open Meetings Act and guidelines, which states that every voting person or member should be seen and heard. Do we have a quorum, Kathy?
Looks like
No
we're
yet.
missing one person. Yes.
Yeah. Okay, so we will continue and we will come back to the approval for the meetings. This is December, hard to believe, but we're at the end of the year. And December is known for the month for the awareness of national impaired driving prevention, particularly related to the end of the year celebration. So let's keep this in mind and encourage everybody to prevent impaired driving. It's also the seasonal affective disorders awareness month, which is highlighting, the high risk that exists during the less hours of sunlight that we have. Let's beware and support one another. It's also the National Human Rights Week. We are going to have it this month, and the International Human Rights Day. And to finish it, it's also the World's AIDS Day celebrated during December. With the experiencing of the cold weather and the higher risk for upper respiratory viral infections, the Board of Health continues reminding the community about the importance of getting flu, RSV, and COVID immunizations to prevent severe infections that may lead into hospitalizations and death. Remember, immunizations or vaccines are safe and they work. For the last 6 weeks, the Kentucky Department of Public Health reports a rising rate of positive results on all the testings, particularly in COVID, but influenza is increasingly a high speed, and also is reporting an increase in the number of emergency visits due to respiratory illnesses throughout the Commonwealth. So let's invite everybody to get vaccinated, and we need to avoid the scenario we had at the beginning of this year with so many cases of influenza that led into school closures and many, many missing of working days. Today, for our perspective session, we're going to speak and we're going to listen about emergency preparedness. We have Paul Kern and Dana Navario. Paul Kern is a public health preparedness administrator for the Louisville Metro Public Health and Wellness Preparedness Division, and has been with Louisville Metro Public Health and Wellness for 9 years. Has extensive experience in Red Cross disaster response, as well in public health, emergency planning and response. He holds an MBA from SIUC, and his a graduate level certificate of completion in emergency management and a master's in safety, security, and emergency management from AKU. We have a experience working with Paul, and we are very grateful about it. Dana Navario is the Community Preparedness Coordinator and is serving in her 8th year with Louisville Metro Public Health and Wellness. Her areas of focus include community partner engagement, community education, and preparedness response plans. And we also have a history of working with her, and we're grateful for that. Today, I present to you Paul Kern and Dana Navario. Welcome you both, and if you have your presentation and you want to share it, please do so. The floor is yours.
Thank you very much. We are very happy to be here, and we're also very pleased to have made arrangements for snow and cold weather for this meeting. Too bad it wasn't yesterday, because the snow was even worse than today. But one of our preparedness plans that we have out there, and just to give you all an overview, we're going to talk a lot about winter emergency and those types of plans. But so everyone is aware, we base a lot of our work on the hazard mitigation plan that the Emergency Services puts out every 5 years, and there are 16 of those public health emergencies or emergencies that we have to deal with. So just wanted to let you all know that our experience is fairly broad, and that I have a staff of 4 people, including myself. So we spend a lot of time, we're really busy trying to stay on top of the latest threats and everything. So I'm going to turn it over to Dana. Dana has done an excellent job of putting together a lot of community presentations, which is one of our major goals, is to get out in the community and talk directly with folks and help them be prepared. So Dana, take it away.
Thank you, Paul. As Paul mentioned, our job is public health preparedness. So to kick off, what is a public health emergency? This is a wide variety of items. Our major ones are category A threats and agents, smallpox, plague, anthrax, and then of course, we've all been through it, a pandemic, influenza, and disease outbreaks. Now, what folks don't normally consider a public health emergency is other disasters, but we do want to touch on those. Here's a disaster map that is made by FEMA. As you can see, us in Kentucky, our biggest disaster that we always look forward to is winter storms, and we've seen that year and year and year. And we would like to add that extreme heat is also something that we have been experiencing more and more of. As you can see on the chart, severe weather is everywhere, and also the pandemic. So today we're going to focus on the winter storm. Like Paul said, if only this would have been on Monday, but it's all good because we still have a lot of winter ahead of us. So what is extreme cold? Extreme cold is when the outdoor temperatures can rapidly cause our body to lose heat faster than it can produce. It feels colder. Its prolonged exposure can cause to frostbite or hypothermia. There's the public health side of it. It can pose different risks to our homes, such as frozen pipe and power outages, which also affect our health. And then it can be really problematic for groups that have been marginalized and groups in higher risk as well. For our National Weather Service, this is a criteria. So when you hear on the news, there's a blizzard warning versus a winter weather advisory, this is kind of what the data is about. There is a link to the bottom right that can take you straight to this, but this is just an overview of what the National Weather Service provides our community with the language.
And I might want to add, Dana, that we spend a lot of time and work very closely with the National Weather Service, both in the summer and in the winter, to stay ahead of the advisories and the information they have. I have a very good relationship with the folks out at the National Weather Service, at least those that are left. I was very sorry to see John Gordon leave. He was a very animated person and a very pleasant person to work with. But a lot of our information is based upon what we get them with a history of weather here in the Louisville area. Thank you.
Exactly. So how do we prepare? We want to prevent and mitigate. So we want to use techniques such as speaking with your medical provider about what kind of immunizations are best for you. Make sure that you are able to receive well-informed alerts and warnings. Build a preparedness kit. Make a family emergency plan. And then monitor trusted media and knowing who your trusted media is beforehand. And we'll go over most of these in the presentation. So my favorite one, how to build a preparedness kit. What items do you need for your kit? What is different? What do you need? Because your family is very specific compared to other families. So I brought my mock preparedness kit. It's right here. This is my travel one. And the first thing I have on mine is I need a medical device when I'm sleeping. So I have it right there so that if anyone needs to grab it, they can grab that medical device as well. I'm just going to go over a few items that are in my kit. I hope that you've learned something new and you write it down for your own kit. But of course, a little radio has hand crank or solar powered as well. Food safety during power outages. A little guide that says when you should be eating that food and when you should be tossing it. So having any kind of information on food safety and power outage. Classic, a flashlight. First aid kit. I always keep a pack of batteries for my flashlight and other electronics that I might need. I always keep a COVID flu test kit on here because if we're leaving to go to someone's house, I want to make sure that my family knows if they are positive for COVID or flu. My family communication plan, and a list of other preparedness items that I might need. Some medications. So, any medications that my family might take, I write them down to make sure that we grab them ahead of time, as well as maybe like Dramamine, where my partner has motion sickness and if we're going to be traveling somewhere, it would be good to have that on hand. I also have pets, so I always keep some pet food in there, maybe a pet toy. And then I always advocate for folks to have some kind of comfort items for yourself, for your family members, for your children. That way, if you do have to grab and go to someone else's home, they can have something of comfort with them as well. So a preparedness kit should be, tailored around your family. It should be something easy that you can grab and take with you if you need to go to someone else's home or to a shelter. And it's also helpful to have a kit ready for if you're bringing in a family. Let's say you do have power and they don't. So they're coming to your household. You can bring out your kit and already have a charger ready, already have the basics here. We also advocate for everyone to have enough water and food for 3 days per person. So that would be something to look into as well. Of course, my kit has a lot of other items, but those are, I think, the basic ones that I would really encourage folks to build slowly. You don't have to go out and buy all of this at once. When I go to health fairs, I get a little, let me see, a little lantern. I think I got a lantern, so I added that to my kit. And I got that food safety storage from another health fair. So I just add it slowly and build it out as I go.
And one thing
One
I'd
part,
like to add, excuse me, Dana, one thing I'd like to add is you can't wait until the emergency happens to start putting this together.
mhm.
This is one of the things that we try to preach to folks is that you have to be prepared, and that means thinking about and doing this ahead of time because, and I will point to a very unfortunate incident recently, the UPS plane incident, and so many people were unprepared and had no clue as what it meant to shelter in place or how to do any of that, and you cannot do that at the last minute. So please, as you go out and you talk to your friends and family, have them do this ahead of time.
Yeah. Again, just grab a box, toss things here and there. And then the really important part is to let your family members know where this is as well. Um, our family communication plan is really important because yes, we all have cell phones that have contacts in them, but what if your phone does not have battery? I don't memorize everyone's phone number. I have maybe, if I'm lucky, 5 people that I memorize. But in a time of emergency, am I going to remember those phone numbers? Possibly, possibly not. So having them written down, I think, is a really helpful way to have, just that extra plan B in place and then knowing, where you might meet as well. So we have a quick little scenario we'll go through. When we do this in person, we break up into groups and we discuss for about 10 minutes. But I'm going to read out a scenario, and it's just to get us thinking about, what else could we add to the kit of this family? And then, what actions can we take? So in our scenario, we have the national weather predicts a winter storm warning. The governor has declared a state of emergency. I'll read the scenario and then we'll go through what our actions can be taken depending on the items we have on hand. So extreme scenario number 1, it's 8 p.m. and you've lost power during the storm. You and your family have prepared an emergency preparedness plan and a kit prior to the storm. We have a lot of items. We have a shovel, flashlight, blankets, hand warmers, radio, batteries, family member contact list. We know where our warming centers are. We have a low charge phone. Right now, we don't have any symptoms. So what could we do having all of these items in hand to as our next action? So again, usually we would have a small group. Some items that I've heard is this is when I would call my family member and say, hey, do you all have a safe place? Are you able to stay warm? If not, can you come here? In this situation, also check on your neighbors. You might have power, but they might not. You might have all of these things, but people around you might not. In our next scenario, it's also 8 p.m. and we've lost power. You are unable to leave your home due to mobility issues. Your neighbors are not nearby to help you. You don't live near a warming center that can support you. We have a few bottles of water, a few non-perishable snacks, candles, one flashlight, and a low-charge phone. And our symptoms right now are slurred speech, pale skin, and hallucinations. So if we were in this scenario, what would be our number one action? In our groups that we do, it's always use that low charge phone and call 911. Someone has to know where you are. And then our next action is planning for a future disaster. So having family members know, hey, please check on me. Having your neighbors know before you leave, if you know there's going to be a storm, please come check on me as well. And having another, maybe, upping your preparedness kit as well. So what is a cold related illness? So if we're going through those phases of, okay, we are prepared, we're not prepared, we also need to know the signs, know the responses, and have supplies ready. So what is a frostbite compared to hypothermia? When do we seek medical attention? What does that look like? So for frostbite and hypothermia, it's get up the person to a warm area, remove any wet clothing, place do not place them in a really hot environment, such as hot water. That is not going to be helpful. And make sure that they are warmed up in layers. And of course, seek medical attention immediately. We can also look into winterizing our homes. This is something that we can do now. Check our chimneys, make sure that all of our pipes are insulated, clean out our gutters, make sure that our smoke alarms and carbon monoxide detectors are working, and gather supplies. And also, at the bottom, check on your neighbors and check on those that might need a little bit extra help as well. For power outages, we really, really have to stress, do not use a gas stove or oven to heat your home. Do not use a generator inside. Do not have a running car inside of the garage. It's really critical that people know that these things are extremely dangerous and to always have a carbon monoxide detector readily operating and regularly checked as well. Food safety, we are public health. Make sure if the power goes out to keep your refrigerator and freezer doors closed. Prepare for these kind of emergencies. So have extra ice packs already frozen that you can use readily. Look at your medications ahead of time. Do they need to be cold? How can you keep them cold? Again, with those ice packs. And when in doubt, throw it out. This infographic right here has a lot of info, so I'm not going to go through all of it, but there's some good information on, how long can food last and all of that. And at the end, we have more resources on food safety as well. Just like we're going to winterize our home, we're going to winterize our car. I have a little preparedness kit in my car as well. Making sure that my tires are up to date and the oil is there, and the battery and antifreeze is all looking steady. Have my preparedness kit in there. If I'm taking a trip, making sure that others know where I'm going and which route I'm going to be taking, and then making sure that I'm in tuned with the latest weather information. I'm also happy to announce that at Louisville Metro Government, Public Health Preparedness, we have a preparedness in your language digital library. So we've taken multiple resources and had them translated to Arabic, Burmese, Chinese Simplified, English, Hindi, Kinyarwanda, Nepali, Somali, Spanish, Swahili, and Vietnamese. So we'll go over what those are. Here's a QR code and a link, and there'll also be a link at the end. So in our multilingual library, we have an emergency supply list, why preparing makes sense, how to safeguard your critical documents and valuables, how to prepare your pets for disasters. I know people are not going to be leaving their pets behind. I'm not going to leave my cats behind. So I need to know what I need to do now to be able to take them with me. A guide for alerts and warnings and knowing your alerts and warnings. What is the difference between a winter storm warning and a winter storm watch? We also have a Preparedness 101 PowerPoint and then preparedness for individuals with disabilities. So all of those are on our website. We really encourage folks to use them, look at them, spread the word about them. They're on there. They're easy to use. And then one of my last slides right here is, how to prepare. What's the timeline looking like? So we knew that this winter storm was happening yesterday. A few days before then, we could have started getting our supplies together, getting our home ready, our car ready, checking again the smoke and carbon monoxide detectors, and making sure that our vehicle was replenished. The day before the storm, adjusting plans. And I know we did that because we looked at, is school going to be canceled? Is it not going to be canceled? How are we going to be working? Are we going to be working from home? And knowing how to receive those alerts and warnings and bringing pets indoors. And then right now, we're at the during and after. So are we checking on our family members, making sure that our generators are safely away, and then taking it easy also when shoveling as well. So we can start today. I encourage folks to download the FEMA app. It will give you weather alerts, disaster resources, and preparedness tips. And then our local Lens alert as well is where we get up-to-date information for our area. And I'll pass it over to Paul.
Thank you, Dana. One thing I want to stress too is that we've focused a lot today on extreme cold. We also have an extreme heat plan, which is the other end of the thermometer. But we also spend an awful lot of time developing emergency plans for other incidents that may happen: tornadoes, flooding, uh, uh, other of the biological incidents we may have. So, this is just an indication of the work that we put in planning for the community and being able to help folks out there regardless of what happens. So, again, we look forward to your comments and your input. If there's something that you feel like we need to focus on, maybe not necessarily winter weather, but other types of disasters that we may have, please let us know, because we're ready to work on things, and we have a lot of access to other resources that we can tap and make sure we have the latest up-to-date information on a lot of that. So thank you, Dana, again for your excellent presentation.
Thank you very much to both. Do we have any questions or comments for Paul and Dana? Is the Board of Health going and our community members getting your slides, particularly for the resources? Dana, Paul?
Oh, we
I'm
certainly
sure that
can give it to them if they.
Mhm.
Yeah, that's
Yeah,
no
I'm sure we can
problem.
add them to our newsletter.
We would like to have those. Good morning. This
Yeah,
is Stella Moore from the Kentucky
yeah.
Nurses Association.
For a slight donation, we'll be happy to provide them
Of
to you,
course you
Dana,
would.
Eleanor.
Thank you. It's so good to see you both. It was an excellent presentation, and I really would like to have the slides. I'd like to share them in our newsletter for nurses around the state. I know it's just for Louisville, but
Well,
many of the
it's
things that
applicable to anywhere.
it's applicable
In
to
all
anywhere.
honesty, this stuff is yes, we've customized it for here for some things, but in essence, this is pretty general stuff. And if there's other disasters, other situations that you all would like to have some information on, just let Dana and I know, and we'll be happy to pass along with what we have.
Thank you. And I was thinking about the template to have the preparedness plan. You said, yeah, let's write phone numbers, but if there's any chance where we can get a template, family members, neighbors, doctors, emergency, I don't know, maybe something to guide the community on what is easy and the best way to do it, that we would appreciate that. Anybody else? Questions or comments?
I
The only
like
other
the idea.
go ahead, Eleanor.
I like the idea of having something for individuals and for families, but also for organizations like long-term care facilities,
Yeah.
for them to be able to have a template to make sure that they're doing it right. It is a requirement that they have such a thing, but if it comes from you guys, I know that it will be complete and it'll be right.
Thank you. Thank you for the comment. The one thing I would like for you all to please promote getting people to sign up for Lens Alerts. Um, we are significantly under signed up for Lens Alerts here in Jefferson County, and this is a very valuable tool that it helps out a lot. It doesn't contain, tons of information when it comes out, but it does provide you all or the individuals with some basic alert information. So please promote getting people to sign up with Lens Alerts, people within your organization or people that you know. We really could have more participation in that.
I would like to add also and say thank you for the presentation, Marta Sanchez with Gilda's Club. And I was actually going to ask about other languages, and I'm so thankful that you have that also included in there because I know that is something very important. The other thing, are you familiar with CERT, the Community Emergency Response Teams? Do those exist still? I think they were under FEMA.
Yes, I'm familiar with CERT. Unfortunately, I don't believe they have any CERT teams here in Jefferson County. Most of the time that operates through emergency management or through emergency services. So we as the health department do not manage any of CERT, but I am very familiar with CERT.
Okay.
Paul, regarding language, thank you for your intervention, Maria Marta. Do you know if Lens Alert has any other languages other than English?
Not that I'm aware of at this point.
Okay. And we
Yeah,
have a
there is
question.
there is another app that they put out. They have actually released an app for your phone that does a little bit more than Lens Alerts, but the Lens Alerts is probably the fastest way to get information directly for something that happens. And of course, I'm involved a lot with associations that work in rubber town areas, so they are very tuned in to Lens Alerts because that most of the time is the fastest way to get information out to folks at a high level. That something has happened and you need to do something. So, but there is another app that Emergency Services has put out too. So.
Thank you, Paul. Appreciate it. Dr. Mitchell is asking, how many people do we have signed up for Lens Alert? This is something our community engagement team wants to start pushing out more. Do you know?
Well, I wish I could tell you that, but that seems to be protected information that nobody wants to give us. So I'll just leave it at that. I think that's we need to be able to know, but I'm going to look into that some more because I know in the past I think I had heard about statistics for that. So it's not very high compared to the population, but it's a very valuable tool, and I'm was disappointed to find out that, and this was other community members that were trying to find that out as well. So I'm going to look into that.
Thank you, Paul. And yeah, we could go ahead and keep on encouraging everybody to get into Lens Alert. And if you find out about the other app or different languages, please just let us know. Also, regarding the family communication plan, Dana shares that ready.gov has an excellent resource, a template in multiple languages. So that's for our communities that speak other languages. So let's keep that in mind, ready.gov. And thank you so much. Do we have any other questions or concerns, comments? And if not, we are very grateful for this presentation. Paul, Dana, thank you so much. And we appreciate it. Now we have a FEMA app also is available in multiple languages. Oh, that is great. That is great to know. And Paul recommended please download the FEMA app. And that's another advice that we will pass on to our community. Now we have quorum, and we will go back for the approval to the November minutes. Are there any discussions or amendments? Remember, we have to be seen and or heard. Are there any discussions or amendments to the minutes? If none, may I have a motion to approve the minutes as dispensed?
So moved.
Second.
Thank you, Karen. Thank you, Ms. Delener. Any opposed? Oh, I'm sorry. All in favor, please raise your hand or say aye. Aye.
Aye.
Thank you.
I'll abstain since I wasn't there. This is Dr. Scott. I was in at the November meeting, so I'll abstain.
Thank you. Thank you so much. Any abstentions? Any opposed? Motion approved as distributed. Thank you. Thank you very much, Kathy. Please take a note of this. And with this, we're going to pass to our mayor's office update. Do we have Mayor, Deputy Mayor Nicole George?
Yeah, I don't think she's able to join us this morning.
Okay, thank you so much. Connie, good morning.
Good morning.
So we're going to the director's update with our Chief Health Strategist, Ms. Connie Mendel. I yield the floor to you.
Good morning. It's good to see all your faces today. I hope everyone is doing well and weren't impacted too badly with the snow, but it is beautiful outside. I will say that. So everyone should have a copy in your email that Arlena Glenn sent out earlier that includes a copy of the director's report. So I'll just give you some really quick highlights. There is some information here about how our team at Public Health and Wellness provided some critical response roles during the UPS crash and the aftermath. And even as recently, I know Dana Navario has been working with the Community Resource Center. So between our hazmat teams and our preparedness teams and working in the EOC, a lot of work that's being done, and we're so thankful for our team members that are able to do that and the expertise they share with the community. Also want to point out, similar to, or just to add on to what Dana and Paul was saying about shelter in place. What we did learn through the incident is that we have more work to do as a metro government sharing and as a health department, what it means to shelter in place. So for anyone, if you're not in receiving our weekly health news alerts that our communication puts out, our communication teams provides every Friday. It's a great email about public health news and alerts. I would encourage you to sign up for that. In one of those alerts following the incident, there was specific tips given, and we'll share those with you also to help, asking you to share that with your patients, clients, coworkers, colleagues about what it means to shelter in place. And there's a really nice graphic that was created, but the 4 main tips to remember is if you live in a shelter in place area, excuse me, to bring all household members and pets indoors, to close and lock all windows and doors, excuse me, turn off all heating, air conditioning, and fans. Anything that would bring outdoor air in, you want to close that off. And then after the event, once the shelter in place is clear, you want to consider replacing or cleaning any air filters to your heating and air systems. So those are the 4 main points, but there's more information that was shared in that email, and we'll be sure to share that out with the board. So other interesting updates in recent weeks, our wastewater surveillance system has detected levels of norovirus in our Louisville wastewater. So this is a signal from sewers, not the hospitals, but it is a warning sign that virus is circulating in our community. So as many of you all know, noro can be a very symptomatic case of gastrointestinal disease. So, what sometimes we refer to as stomach flu, it's highly contagious. It takes very few, cells of that virus to spread. And it can cause a lot of nausea, vomiting, and diarrhea. It does spread really easily. from one infected person to many people. So we want to be really careful about touching surfaces, and then, not having your, fingers towards your mouth, or, making sure that we're always washing our hands really well before eating and drinking. So there's some tips in there. Please share. If you are sick, we encourage everyone to stay home, wait at least 48 hours, particularly after vomiting or diarrhea, before turning to work, childcare, school, all of those things, because this virus does spread really easily. Luckily, most people do recover, although it can cause dehydration and hospitalization with others. So just look at that information and share. We, as we always say, whether it's a stomach flu, gastrointestinal, or flu, respiratory, anything with fever, we always want to stay home as much as possible, and refrain from working and returning to school until your symptoms have improved greatly. More information included in the report talks about the Louisville Community Food Resource Hub that's now on our website. So this is a simple guide to local food assistance programs, pantries, and nutrition services. And this is our first version. We will be updating this with more comprehensive communication strategy and community feedback over the next few months. We're happy to see that SNAP food programs have been reinstated, but we know even with those programs that food security and food access is a concern for a lot of our community members. So when you get a chance, review that and share information there. And then just the last thing on our report, or it talks about QPR training, which is a suicide prevention training that's question, persuade, and refer. We are working with the Louisville Metro Office of Social Services, providing this training to government employees. So this is a 90-minute training, and it just teaches how we can help someone who's experiencing a mental health crisis or who may be considering suicide. This is something that we're always concerned about. We had recently released a report with suicide data for Jefferson County and the trends. And I know we talked about that also. I think Ben Goldman was here and talked about with the team. So we need to continue to talk about suicide. We've got to remove the stigma around it and have those conversations. At one time, people thought that talking about it would encourage someone to commit suicide, but that is not true. If someone is considering that, whether you're asking questions is not going to encourage them anymore. It actually helps to answer questions. We refer people to seek, counseling or advice or therapy, and always utilize the suicide lines, the 988. That should always be a first a call if someone is considering, just like Dana's presentation. If you're sick and you're not feeling well and you have low battery left on your phone, you call 911 for medical help. And the same is true for mental health. It's an issue that many of us suffer with, and it should not be a stigma. We should talk about it widely, openly, and encourage others to seek help. So that is it for today. I'm always happy to answer questions, and we will definitely send follow-up materials after today's meeting.
Thank you so much, Chief Health Strategist. Any questions or for Connie Mendel?
And I see Dr. Single is also here.
Yes, thank you, Dr. Single, our Executive Director. Dr. Bart Ewen has been summoned for jury duty, so he won't be sharing Family Health Center report today with us. But for healthcare coverage and outreach, we have Ashley Shoemaker. Ms. Shoemaker, please.
Yeah. Wanted to share some important open enrollment dates with you. Medicare open enrollment ends on December 7th, so that deadline is coming up. The Marketplace open enrollment ends on January 15th. And for Medicaid, members can enroll or switch plans at any time during the year. So there is no Medicaid open enrollment. For the Marketplace, we are hearing reports from connectors and agents across the state that it is a quieter open enrollment than expected. And we're seeing more people scheduling appointments and then, no showing. We think it is largely because of the increased cost because Congress has not taken action to extend the enhanced tax credits. We are seeing plans increase on average $100 a month. We are also right now seeing more people disenrolling or canceling their plans than we're seeing new members enrolling. So we are seeing a decline in the number of people that are enrolled in Marketplace plans. And of the ones that are choosing to stay enrolled, we are seeing a movement down from gold level plans to silver plans, or from silver plans to bronze plans, so going down metal levels. And those lower metal levels, the bronze plans, they do tend to have lower monthly premiums that might, fit someone's monthly budget better. But these are high deductible plans. So a lot of people that are choosing to enroll are switching over to high deductible plans. So our next meeting for the coalition is scheduled for Monday, December 8th at 4 o'clock. Does anyone have any questions for me? Okay,
Dr.
thank you.
Shah, do you have a question for Ashley?
I had a quick question, actually. In terms of, do we have statistics on how far down folks have moved, right? Because this sort of plays into access to care or access for care for patients. So is that something that can be shared?
We don't. We just know that is a general trend. I don't think we have specific numbers yet, but we should have those numbers for the next meeting.
Thank you, Ashley. Anybody else? This information is very disheartening and
I have a
worrisome.
question.
Yes, go ahead.
Ashley, first
Yes,
of all,
Dr.
thank
Sindel.
you for always keeping us informed. I think you probably know this subject matter better than the back of your own hands. I have a quick question coming out of ignorance. So this increase in the $100 a month, have we ever thought of approaching community partners like Humana Foundation or Jewish Heritage Foundations or Games or the big foundations to help us? Because if you think this through, just a quick math, we have 200 some thousand Medicaid recipients, and Jefferson County, whatever that number is, and let's say 20% are attrition, 20% attrition due to, when you multiply that by $1,200 a month, that's not a huge sum for foundations like Humana and some other big foundations.
Yeah, I don't know that we've had that conversation. This is a a national issue that just across the country. In Kentucky, we're seeing the premiums increase on average $100 a month. Other states are seeing much higher increases. But yeah, these are for the marketplace plans. So with Medicaid, there is no premium, there's no monthly premium. But it is the payment assistance that people receive. They're receiving less assistance. So they are still getting some of this enhanced, some advanced premium tax credit. But it's just not as generous as it was because of the expiration of these enhanced tax subsidies.
Thank you so much, Ashley. Thank you, Dr. Singal, for your question. Regarding the Immunization Advocacy Committee, we will have a meeting next week on Thursday. So please, if you're interested, participate with us. Arlena can share the link for all of us. For JCPS, I don't see Dr. Eva Stone here. For Greater Louisville Medical Society, I yield the floor to Dr. Jeffrey Goldberg.
Yes, good morning. Just a couple items to report. First of all, touching on immunizations, we share everybody's concern with the misinformation that is coming from the federal level, and particularly recent changes to the CDC website. I'm sure everybody's we're working with the Kentucky Medical Association, the AMA, and other national level partners to look for ways to counter this misinformation. And I won't belabor that. That's been the topic of a lot of conversation. But certainly if anybody has any ideas for how organized medicine in particular can lend expertise to countering some of this misinformation, we're certainly open to suggestions, but we're looking at pursuing some legal avenues and other strategies. The new legislative session is upcoming in the next few months. Our policy and advocacy team will begin meeting in January to formulate recommendations to the Kentucky Medical Association for important policy positions that the KMA can take in advance of that legislative session. Again, if anybody has any suggestions, thoughts as to areas that need to be focused on in the upcoming legislative session, we'd certainly be open to input. So please feel free to contact me with any particular areas that you'd like us to advocate for that are not already front and center. That's it. Thank you.
Thank you so much, Dr. Goldberg. Appreciate it. Thank you. And yes, if you have any ideas or topics to pursue, please share them with Dr. Goldberg. For the Kentucky Nurses Association, now I yield the floor to Ms. Delano Manson. Ms. Delano.
Thank you. Good morning. Dr. Goldberg, I would like your support on workplace safety. That is a bill that we will be putting forth in the upcoming legislative session, and it will be sponsored by Representative Nema. So if you're looking for a topic force that you can support, I think that you can support that.
That would be great. And I'll liaise with Senator Nemes on that, or Representative
Sounds
Nemes.
great. We're going to be sending you a letter asking for your support up front, so he knows that we have many organizations and other professions that want to support us as we move forward with a focus on workplace safety. Also want to bring forth, and I sent a copy of the press release to Arlena, is that I'm sure that you all are aware that the Department of Education has deemed at this time that nursing is not a profession. The importance of that is not just that we would be seen as a non-profession, but the impact on access to graduate funds, which means that nurse practitioners, midwives, nurse educators, senior administrators would not be able to get adequate funding to go back to school. So that's a very important issue for us. And I hope that you will sign the petition that we will be sending to the Department of Education to say that we need advanced degreed nurses. And by gone, we are a profession. So if you would do that for us, that would be great. But the real focus is access to funds. Not so much the title. We can work on the title piece if we can get access to funds so that we can, and public health is another area where we would be lacking nurses if we do not have access to funds. And that's my major issue and request, is that you sign that petition. On Friday, we were at 200,000. We need to get to 500,000 and then 1 million to make this, to make it sure, to make Department of Education and those who are making those decisions understand why this is important. In the press release, it lists 16 areas that require advanced education for nurses to be able to perform in those roles.
Thank you, Ms. Eleanor. We'll make sure that Arlana shares the petition with all of us. And Dr. Goldberg, this is another issue that needs the backup of the Greater Louisville Medical Society. Thank you so much. Appreciate it. Is there, regarding all business, do we have any old business to deal with? If not, for the board members, a reminder to please don't forget to send the proof of receipt form for the open meetings and open records materials and guides that were distributed last November 5th. These documents were shared with every elected official and every member appointed or elected of Metro boards, commissions, committees, authorities, and local government bodies. This applies to both current and newly appointed members. If you submitted your response already, please disregard this message. But if you didn't, please make sure you complete this before December 15th. That's our hard time. And if you need the information once more, please send a message to Arlana so she can guide you and support you. And for new business, Louisville Metro has made available some flu and COVID mixed tests. I think the community has to go to the Louisville Metro community centers or call and ask. It was first come, first serve. But this is as important as immunization. If you are sick, get tested. COVID is still active, is causing mortality cases with older than 65, and influenza is coming. So be ready. Let's have all those home tests ready at home. For other new businesses, the Jefferson County Attorney's Office will be transitioning a new attorney assigned legal counsel for the Board of Health and Louisville Metro Public Health and Wellness. His name is Pat Mulvihill. And Natalie Johnson has a new role. I want to express the most sincere gratitude to Attorney Natalie Johnson. Her guide, expertise, and willingness to collaborate with the Board of Health and Louisville Metro Public Health and Wellness, it is really, really, really appreciated. Thank you so much. And the Board of Health is looking forward to work with you, Attorney Pat Mulvihill. Thank you. If we don't have any other topic, thanks everyone for taking time to participate in this month's meeting. The next meeting will be held on Wednesday, January 7th, 2026, already a new year, at 8 a.m. This will be also a virtual meeting. I want to wish a joyous holiday season and the best of health for 2026 for all the board members, Louisville Metro Public Health and Wellness staff, and all the community residents in our Jefferson County, Louisville Metro area. Thank you very much. With this meeting is officially adjourned. Happy holidays, everybody. Thank you.
Thank you.
Goodbye.
Thank you.